Well, good morning, and thank you for joining Eggheads. We are going to get started in just a minute here. I think that we're all maybe just getting ourselves into the meeting, so give us just a minute and we're going to go ahead and get started. Thanks for being here. All right, hopefully everyone's gotten their coffee or whatever it is that they like to have at 8 a.m. on a Thursday morning. It's just 8 o'clock. I think we'll go ahead and get started because we have a lot to talk about today, and I want to make sure that we have enough time for questions at the end. Good morning again, and welcome to Eggheads, the Colorado Health Institute's monthly webinar series. Great to have you with us today. I'm Sara Schmidt. I'm the interim president and CEO at CHI. Couple housekeeping things before I start. A heads up that this session is being recorded. We've also activated captioning for speaker remarks, which you can activate at the bottom of your screen. We will be sure to save plenty of time for questions at the end of the presentation, because as I said, we do have a few panelists with us today. Want to make sure we can have as much dialogue as we can. That said, if you have questions, please be sure to drop them in the chat, or feel free to also use the Q&A function for the webinar. My colleague Joe is working behind the scenes and he will respond as we are able. We'll also just track those questions for when we get started. Speaking of getting started, I want to acknowledge that we are gathering this morning on the 24th anniversary of the shooting at Columbine High School. A significant moment for many of us in Colorado. But I also recognize that this issue is not just in the past, but a very real challenge that is facing youth and families and schools and communities every day. It's maybe part of why you've joined us this morning to really talk about how we can strengthen our youth mental health ecosystem, both in and out of schools. And we are grateful for you being here and excited to hear what you have to share with us and with one another. So to that end, let's let each other know who is in the virtual room. If you wouldn't mind, please share in the chat who you are and maybe what interested you in the session, or maybe share if you are working in schools or part of a community-based organization, maybe you're with an advocacy group or philanthropy, wherever you're coming from. Please just drop something in the chat so that everybody knows who's in the room today, the virtual room today. Thank you. And I see, great, we've got some, oh wow, they're like coming in. They come in very fast, and which is great. Larimer County, Denver Post, Stacy with the BHA, Healthier Colorado, our public health colleagues, Colorado Education Initiative. Thank you so much. Great. Oh, this is really exciting. Thanks, everybody. Colorado Access. Great to see our public health partners and colleagues here with us and from all across the state. Very exciting. Some philanthropy. Great. Please keep dropping your name in there and let us know who's with us. And again, thanks for being here. Now I'm very honored to be introducing our speakers for today. Here is the lineup. My colleague, Kimberly Fu with the Colorado Health Institute. Also, we are both very honored to be joined by Alan Harmon with the Center for African American Health and Sara Nadelman with Gary Community Ventures. And you'll be hearing from both of them, from all three of them actually, in just another minute. I also want to give a shout out to two former CHIers, Guadalupe Solis and Alex Caldwell, who made very important contributions to this work. So thank you to the two of them as well. If we go to the next slide, I just want to share briefly, if you're not familiar with CHI, we are a nonprofit, mission-driven research and consulting organization. We advance equity and well-being in our communities through our deep expertise and implementation know-how. And we are pleased and really honored to have been serving the state for more than 20 years, working with community groups and providers, state and local government agencies, foundations, doing all kinds of exciting and powerful activities, from strategic planning and facilitation to analysis and data and communication. So we're grateful to our partners and excited to work with more. Last year, CHI focused our philanthropically funded work, forgot my prop, what we refer to as our health agenda, if you haven't seen it, on 3 initiatives that are critical to address if we are to advance health and health equity in our state. Those 3 focus areas that you see on the screen are climate and health, integrating systems of care, and behavioral health, which we are excited to be talking about with you today. And want to recognize our philanthropic supporters who help us advance these different initiatives, including the Colorado Trust, Caring for Colorado, Rose Community Foundation, the Denver Foundation, as well as Zoma Foundation and Gary Community Ventures, which fund our work, especially within our behavioral health portfolio. So thank you to all of you for helping advance that work. So let's get started. Why are we talking about youth mental health? Why are we talking about it now? As you can see on the screen, and this is not a surprise, youth mental health needs have exacerbated. According to the 2021 Colorado Health Access Survey, adolescents ages 11 to 18 saw their rate of poor mental health double when we're looking back since 2017. So that's from 8.8 to 18.5. That's nearly 1 in 5 young people reporting poor mental health. If we look at another data source, the Healthy Kids Colorado Survey, another Colorado data source, we see very similar things. For example, looking at all high school students, nearly 40% of high school students felt so sad or hopeless almost every day for 2 or more weeks in a row that they stopped doing their usual activities. And these big picture for all youth data are troubling. What we see on the screen here, though, from Healthy Kids is that we know some groups of young people are experiencing greater struggles. And so when we look at these data broken out, for example, by sexual orientation, we really see that not everyone is experiencing things the same. We know overall kids are struggling, and then we know we have some young people who are having an even harder time. And it's not just COVID-19. Youth are experiencing stress and anxiety because of so many things: social media, racial injustice, school shootings, climate change. I would imagine that if you have any young people in your life, you are likely to be all too familiar about the impacts that these issues are having on them, and then things that we haven't even talked about yet today. And we are at such a crisis moment that, as you can see on this screen, that our leaders from across the state, led by Children's Hospital Colorado, have declared a state of emergency for youth mental health. So with that as a backdrop, we partnered with Gary Community Ventures in 2022 to really understand what is needed today to develop a strong and equitable mental health ecosystem, while also recognizing that there's a lot of work that's already underway to be building that system. So we sought, when we carried out our work, to really narrow our focus, thinking about the role of advocacy organizations, community-based organizations, schools, and philanthropy. And we put this report together to help illustrate where we can start or where we can continue our efforts. So to summarize what we learned through the work, here are a couple of takeaways that will focus our conversation for today. First, we know it's possible to improve the ecosystem. Y'all are on this call for a reason, and you're doing that work. And we know that there are solutions that are available to us. Secondly, we need to invest in solutions that reinforce our priorities. So let's look for the qualities that we want to see. Maybe we want to see equitable, sustainable, timely change, and then invest there. Invest in those programs with our time, with our energy, with our resources that achieve those results. And then lastly, we need to go deep with and in our community partners and in our communities. So we have to be working together, but then we also have to be working with youth, working with families to find the right fit for these solutions. And that's one caveat that I want to flag as we dive into the findings, is that implementing the policies, the programs, the initiatives that we're going to talk about today may really look different depending on the community that you're in and the young people whom you're serving. So we will be highlighting some examples, and we really invite you to think about how some of these solutions might need to change to account for the differences within your region, whether it be geographic differences, age differences, racial differences, etc. So with that, I'm excited to hand it over to Kimberly, who is going to kick things off. She's going to describe a little bit about our process, because of course we always want you to know about our methods, and then really dive into the findings with Alan and Sarah. So thank you.
Thanks so much, Sarah, and good morning, everyone. It's great to see you. As Sarah's mentioned, before we dig into the solutions, we kind of just want to set the stage for how we got here. So CHI started this project with a couple of research questions in mind to guide our approach in understanding the primary barriers and potential solutions to improving the youth mental health ecosystem. First, we wanted to understand what gaps and key problems, specifically in schools and communities, were defining the youth mental health system. Second was understanding the assets. What do we know is working well in terms of programs, initiatives, and policies, and how could those be scaled up? And our last question was around action. What infrastructure, such as funding, leadership, innovation is needed, and who must act? To begin answering those questions, our team conducted a literature review, which was focused on best practices and solutions, both here in Colorado as well as in other states. We held 3 focus groups to hear directly from high school aged youth, parents and caregivers of youth, and community-based organizations. We conducted key informant interviews with leaders in schools, advocacy groups, and behavioral health care. And once we identified several solutions, we conducted a feedback session with an existing coalition of policy advocacy organizations who are focused on the youth mental health ecosystem. We then synthesized everything we heard and began bucketing them into 5 pillars of what a strong and equitable youth mental health system looks like. The first pillar is prevention and early intervention, meaning that there's focus on upstream approaches such as building resilience, early detection and treatment, and addressing social determinants of health. The second pillar is workforce and having high capacity, accessible, and diverse service providers who are integrated into the places where youth live and learn. The third pillar is culturally responsive approaches, meaning that youth and their families have access to affordable, evidence-based, and culturally responsive programming, including those that have been built by and for people of color. The fourth pillar is recovery-oriented mental health crisis response. And this means having youth-specific treatment approaches that are comprehensive and support youth and their families during and after they experience a mental health crisis. And the final pillar is infrastructure and coordination. So to make everything work, we need all of our systems to be talking to each other. We need to be able to coordinate care between schools, healthcare providers, family, youth, and other systems. And we need to be able to share data. So we know that the youth mental health ecosystem is vast, and there's a lot of things that are needed and a lot of work to be done. So to help us narrow the solutions we were finding and hearing, we created some guiding criteria. Our report focuses on solutions that would be equitable. For example, programs that are culturally and linguistically responsive and would eliminate racial, ethnic, and other disparities in youth mental health outcomes. We also wanted to ensure solutions were evidence-informed, so programs or initiatives that have emerging, promising, or established evidence. Our solutions also needed to be sustainable. So again, we know that there's a lot that's needed when it comes to youth mental health, but we wanted to identify solutions that would remain in place and positively impact historically excluded youth for years to come. And finally, we wanted solutions to be timely, things that could be implemented in the next 2 to 4 years, but have a really potential for impact. On top of this, we categorized solutions to make them more actionable by identifying the type of solution it was, as well as the setting. So all solutions are categorized as either policies, programs, or initiatives. Policies refer to mandates within local and state governments, institutions, or organizations that would facilitate access to sources of mental health wellness and supports. Programs are services that are directly increasing access to mental health care for individuals or groups of youth. And initiatives are sets of actions that are needed to develop, promote, or increase access to mental health wellness at a population level. And again, as I mentioned, we also identified the settings in which the solutions could be implemented. And we focused specifically on schools, communities, as well as those that are needed at a systems level. As we dig into the pillars and the example solutions, one thing I want to note is that specific to this presentation, we're also going to be calling out some of the primary actors who are needed. So we can take those solutions one step further and really highlight where these groups, specifically philanthropic organizations, schools and community-based organizations, as well as advocacy groups, can plug into the youth mental health ecosystem and really demonstrate that everyone has a role here. So again, the first pillar is prevention and early intervention. One identified solution here is to create culturally responsive safe spaces in schools and communities. You can see here on the right-hand side a quote from one of our high school aged focus group participants who spoke to why this was so needed. So I'm going to pause here for just a moment so you can all read this quote. So you can see here that it was really powerful to hear students saying that they needed and wanted the ability to talk about their experiences because it was so easy to feel isolated, alone, or like they were the only one going through it. Schools, communities, and philanthropic organizations have an opportunity to work together to create these spaces for students that are going to destigmatize mental health, are culturally affirming, and can offer services like peer support, mentorship, and allow youth to explore topics like leadership, identity, and belonging. As Sarah mentioned, our report highlights a few different programs and initiatives throughout. But again, these might look different for different communities. But one we'd like to call out today is specific to Native communities in the Denver area. The Native Connections program is run by Denver Indian Health and Family Services and offers cultural and traditional activities for youth, such as beading, hand drum making, and ribbon skirt making. All of these have been shown to improve the mental health of their youth population. But again, this is just one example of a program we know of. So I'd like to invite you all to list in the chat some additional examples of programs that you might know about that center around the idea of safe spaces for youth. All right, we see some stuff coming in. Thank you so much. The Center on Colfax, the Confluence Center in Montbello, Spirit of the Sun. There's a new teen center about to open in Larimer. That is amazing. This is fantastic. Thank you all so much. I'm appreciating all that you're putting in the chat here, and I can't wait to learn more about these programs. Pure Kindness in Montrose. Thanks, everyone. Let's keep those coming so that we can give everyone here on the call this morning some examples about the programs that we're talking about and the ones that we can help support to scale up. But in the meantime, I'm going to go ahead and move us forward to the second pillar, which is workforce. An identified policy that can support a robust and diverse workforce is advocating for alternative mental health workers to be billable by Medicaid. As demonstrated in this quote from one of the leaders we spoke with, we should be looking at creating and supporting multiple pathways to joining the community behavioral health workforce, not just for specialists and providers, but for people who can support families in navigating the system. Community behavioral health workers, such as promotoras or peer support specialists, play a really important role in accessing care. Oftentimes, these folks are trusted community members or people with lived experience, and that allows them to create deep partnerships with the people that they're serving and they can support improving health by coordinating care and informing the kinds of solutions that are needed in their communities. And the good news is that there's a lot of movement around this solution. Senate Bill 23-002 was introduced earlier this year and would authorize our state to seek federal authorization to reimburse community health workers through Medicaid. This is really important because it allows for this alternative workforce to continue supporting the community in a way that is going to be sustainable. And if this is passed, this bill would require the State Department to hold public stakeholder meetings to solicit input, which is needed to make sure that we have solutions that will work for Colorado's diverse communities. And that will be another important place for advocacy organizations to plug in and make sure that we're raising the voices of youth and their families. The third pillar is culturally responsive approaches. One solution that is needed here is specifically to increase trauma-informed family-centered programming. These types of multi-generational approaches can address generational trauma, build resilience, increase mental health wellness, and promote healing within the family system. The importance of this solution we've called out here is demonstrated in this quote, which is from another high school aged focus group participant. And I'm going to go ahead and read this one out loud. We're surrounded by adults who are not taking care of their mental health, and so we learn not to take care of our mental health. Seeing our families deal with this without getting mental health help makes youth think that they can get away with dealing with stuff without mental health help. Again, there's opportunities for philanthropic leaders and community-based organizations to partner and scale up the programs that are going to address this systemic issue, which importantly includes investing in research that can increase the programs and services that are being built by and for people of color. And so now I'd like to pass it over to Alan Harmon, who is the Community Resource Navigator from the Center for African American Health, to talk about some of the programs they provide.
Good morning, everyone. Hope everyone is doing well. Thank you for inviting me into this space. So my name is Alan Harmon. I work at the Center for African American Health. I'm a community resource navigator responsible for our parenting education programs. Those two programs that I facilitate and that we offer are the Strengthening Families program, which includes the 5 protective factors, and then also a 24/7 dad program. And both of those programs are meant to help families become stronger, tighter units, and how they can work together as a family and help each other as they grow throughout life. We do know the importance of having a strong family at home, help people as they move forward throughout life. And those are the 2 things that I'm here to talk about today, and those are the two of the programs that we offer. Thank you.
Thanks so much, Alan, for being here with us this morning and for sharing about those programs. They're just so important to making sure that youth are able to build resilience, which starts in their homes. We'll be hearing from Alan again in a few minutes as we get to a discussion. So if you guys have questions, please go ahead and start thinking of those, and you can drop those in the chat and we'll get to those in just a few minutes. But in the meantime, I want to bring us forward to the 4th pillar, which is recovery-oriented crisis response. Again, this is about having spaces that can appropriately serve youth and their families through a mental health crisis and promote long-term recovery. And in order to do that, we need to start with comprehensive youth-specific interventions and follow-up. Parents and caregivers we spoke to talked about their experiences during a mental health emergency and how they felt like they were often left to figure out on their own how to find help for their kids during what is already a very difficult time. And on top of that, we heard from providers that when youth do experience a mental health crisis, they're often evaluated in emergency rooms or adult psychiatry settings, which is neither safe nor therapeutic and often lacks child-specific clinicians and specialists. Philanthropic and advocacy organizations can partner alongside healthcare organizations to create these spaces that are going to provide high quality specialized care for youth and families who are experiencing a mental health emergency, and to ensure that these programs have appropriate follow-up care that will continue to support youth on their path to recovery. A program that we want to spotlight as a potential starting point for our state to model off of is New York's Bellevue Hospital Center's Comprehensive Psychiatric Emergency Program. This program creates a single entry point for brief and full emergency visits. They are Medicaid reimbursable, and through this program, they're able to provide triage and screening, stabilization and referral, or diversion to an appropriate program for children and their families. And finally, that brings us to the 5th pillar, which is infrastructure and coordination. Again, to make everything work, we need data sharing pathways across all partners and settings that serve youth. And that's going to include human service departments, education, health systems, as well as others. Leaders across these systems can advocate for integrated systems of data, and philanthropic leaders can support this initiative by scaling up or creating these systems and supporting schools in their capacity to address common data sharing barriers, such as privacy concerns. An example we'd like to highlight, again, is another potential starting point that we can model off of. In Washington, D.C., public schools, the Department of Health, and the Department of Healthcare Finance established a data sharing agreement, which allowed these groups to share data across their agencies. And that enabled them to improve the identification of students on Medicaid who had unmet needs. So the examples that we just walked through are some of the solutions that are needed to improve the youth mental health ecosystem. But again, we know that the youth mental health ecosystem is vast and that there is a lot that is needed. So again, we just want to emphasize that everyone here has a role. That's why you all are here. And of course, there are some very tangible starting points for us all. Our advocacy partners can support the policies that are needed to increase workforce and to build the basis for data sharing and coordination. They can also support efforts to raise the voices of those who may have greater risk for worse mental health outcomes. And that includes youth of color, those who identify as LGBTQ+, and those in the foster system, among others. Schools and community-based organizations can work with the community and other partners to identify and implement the programs that are needed to best meet the students and families that they serve. So this includes creating those safe spaces in their schools and communities, which again might look different in different parts of the state, but it also includes providing a continuum of supports that are needed to address the youth mental health system. And finally, philanthropic partners can help schools and communities build capacity. They can also invest in cross-sector partnerships, as well as innovative research and approaches that will support the community for years to come. So to talk more about that role in philanthropy, I'd like to invite Sara Nadelman from Gary Community Ventures to highlight the work that they've been doing.
Thanks, Kimberly. I will attempt to be brief. Thank you so much to CHI, everyone who participated in this research, and everyone here today. I won't go too far into what we're up to, but we at Gary Community Ventures hired this position that I'm in to really focus on youth mental health. A couple quick things about Gary. We are a primarily Denver metro area funder. We fund mostly programs and projects in the Denver metro area, but do policy work across the state. We're sunsetting in 2035. And we have sort of 4 levers that we can pull around how we work with partners, including policy, our ventures team, which is kind of our in-house social enterprise team, mission investing, and then philanthropy, which is the team that I'm on. And one of the things that's really highlighted by this research and by partner conversations is that while we may fund only in the Denver metro area and other funders have sort of regional or local requirements from their board or founders, youth mental health doesn't stop at our county borders. It really is children, youth, and families are all over the state and need our help, which calls for philanthropy to do better at cross philanthropy coordination and also making access to dollars more equitable and useful for the folks who are accessing them. So it's great to see a bunch of organizations from around the state that I have worked with in my previous roles. I will also say that one of the things we really need to do is focus on supporting more diverse and local organizations that are doing innovative work that we can all really learn from. And right now, Gary's really in that space of learning and finding out what folks in our catchment area particularly need and how we can support them with the levers we have. There's people doing amazing work in our area and all over the state that we want to learn about and learn from. So I want to thank all the folks out there who have partnered with us, as well as the folks that we may partner with in the future, and everyone doing great work out there. So thank you.
Thanks so much, Sara, for your insight, and we're excited that you could join us today. We're going to dig in with Sara as well in just a bit, but first I want to bring us back to our key takeaways. Again, we know that there is a lot that is needed, but we also know where to start, and we know that it's possible. Second, we need investments that are equitable, timely, sustainable. And finally, we need to build authentic partnership with communities and work collaboratively across sectors to make sure that solutions are meeting each community's specific needs. So with that, I'd like to pass it over to my colleague, Sarah Schmidt, and invite back Alan Harmon and Sara Nadelman for some Q&A and discussion.
Thank you. Thank you, Kimberly and Alan and Sara. All right, we are just reorganizing ourselves technologically here and are going to get started on the Q&A. So great to see everybody on the screen. I have a few questions for our speakers that I'm going to kick off in a minute, but please put questions in the chat or you can use the Q&A function. We certainly want to hear from all of you. what's on your mind? What would you like to hear from these great folks about, and what are other things that you'd like us to get in a conversation around? My colleague Joe is able to bring you off mute if you would like to also ask your question in person. So, or not in person, that'd be nice, but ask it live. So please just start putting those questions in there. So I'm going to start with Alan. Alan, thank you so much for giving a highlight of the programs that you're working on. And I would love for you to just share, what are some of the types of programs, or maybe it's services, things that policies that you would like to see us as a state make greater investments in? Where do you see those opportunities to make those investments?
That's a great question, Sarah. I think one of the things is, that when Kimberly was talking about culturally community ventures, I think that quote from that student was very powerful, and something I see in my programs. Like, I like to see more opportunities and more stuff for parents, right? So if parents aren't to take care of themselves and get mental health for themselves, they're not modeling that behavior for their children. So if the children don't see that behavior, they don't know what it means to get help or what it means to get assistance when it comes to dealing with some issues and some problems. So I like to make sure there's more things there for parents, so parents can model that behavior. And I do know one of the things that we offer at the Center for African American Health for the Black community, specifically in the Denver metro area, is we offer free free therapy sessions through the Therapists of Color Collaborative. And what that is an opportunity for individuals to get 15 free sessions, and for families to get 20 free sessions of counseling through therapists that look like them and understand the cultural responses and how culturally we're different and things like that. So I think there's more things helping parents and guardians and caretakers, and they can model that behavior for their children.
Thanks, Alan. I appreciate that. Right. Like, kids are part of a unit. We're in a family together. So appreciate that. Sarah, Kimberly, anything that you wanted to respond to or follow up on with Alan before I, okay. All right. Oh, it looks like we just lost, did we just lose Sarah? There she is. Sarah, you shared a little bit about how Gary's levers and some of the work and the learning that you all are doing. What are some other ways that you would encourage philanthropy to think about being a catalyst for some of these different types of solutions?
That is an excellent question. Can you hear me okay?
Yeah.
Okay, great. That's a really good question, and a really complicated question, unfortunately. I wish it weren't the case, but philanthropy has, every organization has a different mission, has a different board, has a different sort of way of doing business. And I think really having funders talk together to make things easier for organizations to access those dollars, and also to get outside of our warm networks to the folks that maybe haven't had access to this kind of like dollars or whomever. I would also say, how do we support different kinds of capital instead of just philanthropic dollars? Are there other things that organizations need? Earned income streams, PRIs. What are the other ways that capital could be helpful, so they're not relying on what can be sometimes a very fickle philanthropic sector? It is the nature of the game, and it's not always the most useful to organizations. So how do we find better and more sustainable ways to help our partners and be truly catalytic instead of sort of the same old, same old?
Thank you. Okay, there's so many good questions in the chat that I'm going to quickly ask two more questions, and I think we're going to start to bring people live to ask some of these questions. Alan, would love if you could share a little bit about how you and your colleagues at Center for African American Health are really building on successes and really developing those partnerships with families, with parents, with youth. Are there things that you want to share with others who might be on the call, things that's worked well for you and that you would encourage others to be thinking about as they're doing their work?
Sure. I think for us and what we're doing, one of the most important things is actually just being out in community, like getting out, talking to people, going to different organizations and having conversations with them. sitting behind closed walls in the office isn't helpful. And being out in community, networking, participating in some of the things that's going on with community, with the youth, with the families, has been one of the strongest things for us, because it shows that we're people of the community as well. And so we understand what's going on. And more we're out in community and less in the building. And I think that's something that's been helpful for us.
Great, thank you. All right, Sarah, last question, last targeted question for you. You talked about sustainable investments. You want to say a little bit more about what that means and how you're thinking about it?
Sure. I think one of the cool things about Gary is we're sunsetting, which means all of our assets have to get into the community by 2035, which is really exciting, actually. And so when we look at sustainability, it's like, how do we go beyond traditional philanthropy, because we're leaving? How do we make sure that the programs and projects and folks are funded permanently through mostly public and business dollars? So I think that sustainability is sort of living beyond philanthropy, and ensuring that these great programs out there have the capacity to be there. That's how we look at it. And I think we want our partners to be successful and there for the long haul, because they're the ones who are actually doing the work in the community. So how do we make that happen? Who do we connect them with that are matching partners, other philanthropic organizations or others who will be a good match for longer term funding?
Thank you. All right, so we have several questions that are teed up. The first one is going to come into us live from Vanessa. I'll invite her to come off mute and maybe introduce herself and then ask her question. Thanks for being here.
Thanks. Hi, everyone. I'm Vanessa Farrell. I'm from the Colorado Education Initiative. And what I noticed so far was just a whole lot of great information and spotlighting of community-based programs. And I think those are super important. But my question is about schools themselves. And I would love to know what you heard from all of the stakeholders that you talked to. What did you come away with regard to priorities for changing schools themselves, not just the community piece of the ecosystem?
Thanks so much for your question, Vanessa. I'm happy to kick it off, and Sarah and others appreciate any other thoughts you might have. I think one of the things we heard is that schools really need to start building up their basis of continuum of supports, right? Because in order for students to be able to succeed academically, we also need to take in their mental health. All of those things really go hand in hand. So being able to be a safe space for the students, as we heard, they want to be able to talk with their peers about realistic experiences that they're having. I think one of the quotes that sticks with me from one of the students we heard from is that, you know, they'll have, for example, this is from their words, cheesy videos, right, about things like suicide prevention or, you know, reaching out for help, but those aren't what they need. They need to be able to engage in real conversations with their peers and with mentors. And schools are one of the best places to do that. And so once we start building up, you know, those supports there, building up the teachers be able to identify needs as well, and not just teachers, but you know, nutritionists in schools, custodial workers, all of those, we're building that foundation of supports for students. And then we can start moving forward and doing things like universal mental health screenings in schools to identify for needs, and having that place where students can go to even get support. That happens right now already, right, with some of the school-based health centers or school districts who have partnered with other healthcare providers to bring those providers into school to destigmatize getting mental health help. Those, I think, are all things that are needed. And again, Sarah Schmidt, Sara Nadelman, and Alan, if there's anything that you all know, I'll invite you all to add on to that too.
Sarah or Alan, anything you'd like to add?
I think one of the things we're hearing is that teacher and school employee mental health is super important, and supporting also caregivers of students have been two things that have popped up that we've heard so far.
Mm-hmm. Great.
Yeah, and a couple things I heard is one, just again, opportunity to have those real conversations, but also in talking to some youth at a high school recently, one of the things they would like to see is like more safety so they can feel comfortable and so they can not be stressed and worried about their safety. So providing that safety piece along with some opportunities and resources to have those real conversations is two things that I've heard recently.
Great, thank you both. Vanessa, if you had any follow-up, if you wanted to type it in the chat or in the Q&A, that would be great. Because I know we have other questions I want to make sure we can get to. It sounds like we have a live question coming in from Sherry, and then maybe we'll pivot to the Q&A for another question. Sherry, come on in. Maybe she can't unmute herself.
Okay, great. Can you hear me now?
Yes.
Wonderful, thank you. So I do want to ask about a policy gap that we have in Colorado that's preventing kids from even getting into the school system. So we do have some really clear guidance on how to homeschool your child that really values family autonomy, but there's no enforcement of that. And so I know firsthand, this became a personal I just know firsthand that this majorly impacted a child involved in my extended family, where she missed 4 years of school completely, being completely neglected in her household because there was no way to get any child welfare enforcement because the parent had unenrolled her from school, and there was no way to get the truancy officer in the school district involved because the child was unenrolled, but yet there was no connection to the policy. So I can only think that following COVID, there's probably a lot of these kids who are falling through this policy gap. So any thoughts on opportunities there?
Thanks for the question, Sherry. And again, that's policy opportunities for kids who are not in school and who have come out of that ecosystem. Sarah, you looked pretty engaged when Sherry started talking. I'm wondering if you have something that you wanted to chime in here about.
I was more thinking we have some amazing policy folks on this call,
Right?
not me. So that was more my point, is there's probably folks who in the chat or otherwise could really address this beautifully. So that was all I was going to say.
That was actually going to be my question to the audience, is that's an area that I'm not familiar with, and Kimberly and I had a quick side conversation. She isn't either. So Alan, if you're familiar with anything, please share. If not, I would love if we have a colleague in our virtual room who wants to respond to Sherry's question by chat, or you could raise your hand and one of our CHI colleagues can get you off mute for you to chime in. I do see some good things in the chat coming in. It looks like we'll wait just a sec in case anyone has a response to Sherry around this policy gap. Well, maybe people are typing in. Sherry, thanks for raising that space and the space where we need to have some feedback and some input around. So we'll keep an eye on that chat. I think we have Laura with us who wanted to ask a question about coverage. So while we're seeing if we get any responses to Sherry, let's open the floor for Laura to chime in.
Thank you so much. This is Laura Cinconi with the Douglas County Mental Health Initiative. So my question is, in the course of your research for this report, was there any analysis of or consideration given to families with private insurance and any solutioning around that, or examples perhaps in other states where there have been some successful programming for families with private insurance? And I ask because the county that I work for has a relatively high private insured population. And now the plans they tend to be high deductible plans. So that creates their own barriers. But just because of the communities that I work in and how the majority are privately insured, I just think about that a lot. And so I noticed that you shared a lot about Medicaid. So I'm just wondering about private insurance. Thank you.
Thank you, Laura. And while I'll invite maybe Kimberly to come off, certainly Alan, I know you're working with families. I will also flag that Stacey Davis did put a resource in the chat, a link to a resource for families with private insurance. But Kimberly or Alan, anything that you wanted to add in terms of thinking about this from that payer, the health insurance perspective? And
that's always a struggle, the cost of the things. And I do know for our organization, the things that we offer is always free to members of the community. We recognize that not everyone is able to afford certain things, so we do offer free services. But there is, so from the private spectrum of it, we don't really have that issue with us because, again, we offer free services. But I do know we often get a lot of times people asking, like, is there some place where we can go to get low cost things or like that? And that's something that we're working on, or potentially compiling a list of those things. But right now, that's just some information we don't have when it comes to private costs for things.
yeah, thanks, Alan. Kimberly, anything? I'm thinking about our family focus groups. I mean, cost certainly was a big issue, and we had people coming from with all types of coverage, and regardless of what that coverage looked like, it was either access, or if they could find someone, it was then the cost. So I don't, certainly that's a challenge. Kimberly, anything?
Yeah.
Come on.
Absolutely. I think we did hear that from a lot of our parents and caregivers that we spoke to. And I think too, it kind of goes back to that first pillar of prevention and upstream supports and intervention. If we can build that foundation within schools, within communities, that kind of helps to lessen, for example, what we see later. And so I think all of those programs, regardless of payer type, those are the kinds of things that we need to build on as a foundation to support youth as well, in addition to solving things like access and affordability. So,
yeah.
And could I just add to that? I think we need to make it easier for folks to get non-traditional interventions and maybe less proven interventions supported by insurance companies and Medicaid. And make it really easy for folks to apply across the Medicaid spectrum as well as across payers to get those programs paid for.
Thank you.
Sarah, do you mind if I ask you a quick question?
Me?
Sarah Schmidt.
Oh yeah, okay.
Quick question.
Sure,
We're aware that the federal government, a $10 billion bill to address some healthcare issues in the country, almost 5 million or 4 million going to the opioid crisis, and then another 5 million going to, or 5 billion, I'm sorry, going to mental health stuff across the country. Do you know if there is an action or a plan in place for Colorado to go after those fundings?
Thanks for the question, Alan. Off the top of my head, I'm not familiar. I mean, I think, and one of the things that we haven't talked a lot about in our conversation today is really the work that's happening at the state level, because there's so much underway between work that's happening at the Department of Healthcare Policy and Financing, at the Colorado Department of Human Services, at the Behavioral Health Administration, certainly also building on the work of the Behavioral Health Task Force. Lots of plans, lots of dedicated resources, both being spent out in the community through ARPA, but then also kind of roadmaps and things that the state is really planning to move forward. I would off the top of my head, my guess is yes, I would assume that there is some work underway to try to garner funds that Colorado is eligible for, but I don't know that I can point to exactly what work that is happening. I do know we have some state partners who are on the call listening in. If they had any insight or feedback that they would either be able to put in the Q&A or in the chat, that would be really helpful. Because you're right, we need investment coming from a lot of different places. And certainly if there's federal resources out there, we want to make sure that those are coming in. I think that we have a question coming from Mary. Mary's going to come on mute and ask her question.
Yeah, can you hear me?
We can. Yeah, thank you.
Great. This is Mary Sunderland. I am a nurse, senior health promotion specialist with the maternal child health program over at Arapahoe County Public Health. And my question was, what would training look like for community mental health workers? So folks not so much with professional training, but wanting to expand that access to mental health workers that really look like the people that are in the community and are more culturally perhaps responsive to them.
Yeah, thanks for your question, Mary. Alan, do you want to share a little bit about how you are equipping your teams when they're going out into community and working with individuals and families?
Sure. Part of it is one is just, training on some of the programs that we offer. I mean, that's always first steps, but then also just allowing people to get out, really learn from community and hear from community is what they need and what they research that they want. I know for things that when it comes to mental health, right? So we offer mental health first aid for both youth and adults. Those programs, again, are free. And so while we're doing those things, we're equipping our staff with, going through those trainings themselves so they know what to recognize, but also how to have conversations and maybe help people in community when they come across those things.
Great. Thank you, Alan. And it looks like a couple people have chimed in on youth mental health first aid as a great resource. Kimberly, anything that you wanted to share just in terms of what we, in the research that you?
Yeah, absolutely. I think it speaks to also a larger issue when we're talking about the peer workforce, because we want to make sure that they're trained and that they also have the resources that they need when they're also going out into communities and helping supporting people and making sure that we're not, for example, re-traumatizing them or putting them in situations that could be potentially dangerous to their mental health wellness as well. And I think there is a lot of movement around that right now. There's also a lot of organizations who are working on like peer support trainings and community mental health worker trainings. So one of the things that I will put in the chat is an organization that I know of, which is the Colorado Mental Wellness Network. So I would definitely encourage looking into that as well.
Great, thank you. Okay, let's see. Do we have someone else? I know we have a lot of, and I'm just really grateful that everyone is putting things into the chat. So thank you for that. I think there's a question that came in from, I'm just going in order, from Sarah, but I don't see her coming off mute, so maybe she's not. Her question is, any suggestions for ways for community to easily find mental health services that are a cultural/linguistic match? That's Sarah's question. Any of our panelists have any? Yeah, Kimberly, you've come off mute.
Hi, yes,
Hi.
I think I know of a few resources. Alan and others on this call might know of some too, but I'm going to start with the Therapists of Color Collaborative. There are also a variety of resources. I think we actually put some together for our focus groups, and I'm happy to pull that up and also share others in the chat too of some starting points that folks might look into.
I will say our organization helps with that as far as the mental health first aid. I do know that Focus Points, which is an organization that services the Latinx community, is a place that people can go to get resources and help there. And that's all I have off the top of my head at the moment. But then so the organization Family Resource Center, they have a plethora of organizations that are part of that association. And you can go there and look at some of those organizations that are part of the Family Resource Center Association and see if there's something culturally sound there or a culturally sound organization for you there.
Great, thank you. Thank you both for.
Can I
Yeah.
add one more thing to that point too? I think there are organizations serving the community that are also great starting points. For example, Center for African American Health, the Asian Pacific Development Center, Servicios de la Raza. Those are all, I think, organizations that can help connect people to services that are culturally and linguistically responsive as well.
Okay, I think we have more questions, but we have time for just one more. I will read it. I don't see anything about Megan coming off to ask her question. So I will read it in the chat. And Kimberly, I think that this speaks a little bit to our methods. So I'm just teeing you up for that. The question from Megan is, in your analysis, are you finding correlations with the availability of certain services and positive impact on youth mental health? So we didn't run any sort of correlation tests as part of this work, but Kimberly, would you mind just sharing a little bit about how we looked at kind of the evidence behind some of the things that we for the programs and policies and initiatives that we are recommending within the report?
Yeah, happy to. Yeah, so as Sarah mentioned, we didn't do any kind of like correlation or analyses like that, but the ones that we were finding again are things that were proven to have some sort of established evidence either. And again, to Sara Nadelman's point, right, there's a lot of innovative things out there. So we didn't want to exclude things that could potentially be innovative and really impactful too. So unfortunately, we did not include any like pilot programs, but things that had already been piloted that were showing promising evidence or had established evidence through either peer literature reviewed research or were being implemented in other states. Those are kind of what we included in the report as well.
Thank you. And it looks like so this has been a great discussion and a lot of really good things in the chat, which is what we had hoped for. We will make the chat available. We'll do a little cleanup of it and make sure that that is available along with the materials so if there's other things that you want to make sure get out there that everyone else on this call has access to in these final moments, please drop it in there. I think I'm turning the floor over to my colleague, Joe, who's going to give us a preview. Before I do that, just want to thank Kimberly and Alan and Sarah very much for your time today and your expertise, and really to all of you for being part of this conversation with us. So thank you.
Thank you for having me.
All right, well, thanks everyone for joining us. I'm Joe Hannell. I'm Communications Director at CHI. I also work on our Legislative Services team, which is why I'm talking to you right now. Please join us the last Thursday of May for a wrap up of the legislative session. I wish I could give you some more details on that right now, but things are still very much in progress. So we just know it's been extraordinarily active and controversial session, and we'll have wrap up with some good guest speakers for you. So click the link in the chat. You can sign up right now. And with that, thank you everyone for being here. I'm gonna stop recording and end the webinar. Have a great Thursday, and we'll see you all next month, I hope.